I am the co-founder of Boomer Benefits. We are a national licensed insurance agency that helps baby boomers navigate their entry into Medicare at 65. We teach them everything they need to know about Medicare and the benefits they get from their federal government. And then we help them on the back end with setting up policies like Medicare Supplement, Medicare Advantage, and Part D drug plans, which are things that supplement those benefits from original Medicare, kind of round out all the pieces that the client would otherwise have to pay. And I am the author of 10 Costly Medicare Mistakes You Can't Afford to Make, which is easy to find on Amazon and Barnes & Noble, and just something we put together from our many years of helping beneficiaries and seeing that they make some of the most common same mistakes over and over again, so that we can educate the public on how to avoid those things and keep more of that hard-earned money in their own pockets.
Right on. That is awesome. And I've got a million questions for you, Medicare related, that I think
Okay.
a lot of the listeners will be happy to hear asked to an expert like yourself. But why don't we start with some of the most common mistakes that you see made over and over and over again when it comes to enrolling in benefits?
Yeah. So sometimes people come into Medicare and they start their learning on the day they turn 65. So, first things first, you should really be looking at this when you turn 64 because there's a lot to learn. Medicare is confusing. You've never been part of a national health insurance program before, and it works quite a bit differently than the type of insurance you've been exposed to in the past. So, really important if you want to make good transitions, good selections, that you give yourself time to digest that material starting around 64 and 64 and a half. There is great content available for free on places like YouTube. You can find the Boomer Benefits channel there and lots of other good channels. Medicare itself, Medicare.gov, has a lot of great website information for you to start educating yourself about all the things that Medicare has to offer. And so, first things first, give yourself some time to learn all of that. And in doing so, that will make sure that you avoid the mistake of not enrolling during your initial enrollment period. People are unaware a lot of times that you can't just go and sign up for Medicare whenever you want to. There are penalties if you miss that and you have a late enrollment without creditable coverage. So you will have an initial enrollment period that starts 3 months before your 65th birthday. It goes through your birthday month and goes for 3 months after. And that's a time when you should be signing up for original Medicare Parts A and B, unless, of course, you're still working. And then if you are still working, which pieces you should enroll in, which pieces that you can delay without penalty, will depend on the size of company that you work for. And so you can see why if you waited until the last minute to figure these things out, you might be in danger of missing an enrollment period or perhaps enrolling in something that's going to cost you money that you could have delayed. And all of that takes a little bit of time to learn. So my first piece of advice would be that.
Who might be a good fit just for the Medicare Advantage that's less
Yeah,
costly?
I love this question. And something I find is that a lot of times financial advisors or financial planners, they are working with clients that have put money put away, right? They've anticipated retirement, they've saved money, they're ready. And so we often find that those people, a lot of their clients are people who have the extra money to spend and buy the most comprehensive coverage and sign up for a Medicare supplement. But in actuality, about 34% of all beneficiaries choose Medicare Advantage plans, and that's for a number of reasons. One is price. Everybody loves a plan that is zero premium or $20 premium. They're a lot less expensive. And also, Advantage plans have the option to build in ancillary benefits. So you will find them that have things in them that original Medicare doesn't, namely dental, vision, and hearing insurance.